And the big thing is this, is that 40s is way too young to be having reduced hormones for men. Way too young, like way too young. So we need to, hopefully you read the book, The Rain Barrel Effect. You use the de-stress protocol, without a doubt. You're using the right type of diet plan. You're getting enough protein. You're doing your 3 days a week of resistance training. You're not overtraining and wearing down your hormones. And then if needed, we'll just give you the extra support. Check out my podcast on boosting testosterone. Vitamin C, zinc, there's some other great things in there. And you need to make sure you're getting all of your nutrients. And then if we ever need to, certainly not in your 40s, but if we need to, we'll use DHEA for a boost to get you there. And then we'll taper off of that in, anywhere from 3 to 6 months. And then maybe in your early 60s, late 50s at the earliest, we might add in DHEA for both men and women because it's a precursor, a pro-hormone that leads to then more testosterone. And more testosterone is going to lead to less adiposity or less body fat gain. It's going to lead to better mood, more strength gains, more endurance, no doubt about it. So I just believe that 40s is way too young to be using hormone replacement therapy because it's also the prime years, basically 30 to 60, 30 to 70 years old, let's say 65 for happy medium, where your chances of getting anabolic-based disease increase. So that's why the more protein, the more testosterone, the more anabolic you make your body, the more chance of cancer, heart disease, etc. So again, I just don't think that you need it right away. And I just feel that it is short-sighted because when you go too high in these hormone replacement therapies, which most men are, they pretend that they're bringing their levels back to their 20s, but really they're off the charts. And because we test guys all the time. I mean, I do this for a living. And so anyway, there's other ways to go about this. Thank you for writing in.